So clinical pearl number 37 talks about medication side effects that can interfere with a person's ability to eat. And one of the most common things we might think about is a medication that causes nausea. So we know that sometimes people with intellectual and developmental disabilities don't communicate in the same way. They might communicate through behaviors. They might become resistant to eating if they feel nauseated. They might not want to eat if they feel nauseated. They might even become agitated because if someone is trying to, help them to eat or assist them to the dining table, they may not want to go because they feel very nauseated. And there are a number of medications that can do that. One of the big things we think about are antibiotics, but there are tons of other ones that can cause nausea as well. Other medication side effects to think about is something that's called anticholinergic effects. This is basically a drying up of everything, of all the fluids in our body. And sometimes we want this, okay? So if our nose is really stuffy or runny, we take antihistamines or decongestants to dry up that runniness, but that also can dry up your mouth. Some of the antipsychotic drugs can do that as well too. And if your mouth is very dry and you don't have much saliva, you can't moisten the food in there, and it may make it very hard to swallow and can actually increase the risk of swallowing if you can't moisten the food enough. So think about those types of medications. Some medications, mostly antipsychotics, when we think about those, can cause something called tardive dyskinesia, which can be a permanent type movement disorder. And it can affect a lot of different parts of the body. But one place you might see it is a person's mouth. You might see tongue thrusting behavior. You might see lip smacking behavior, and this is involuntary movement. And if a person is having this problem and it's affecting their mouth, then it can make it very hard for them to eat. If their tongue is constantly thrusting outward, you can imagine how challenging that would be. There are some medications that can help reduce those symptoms as well. Which is a good thing. Extrapyramidal side effects also, we see this in a lot of antipsychotics as well too. Parkinson type movements, akathisia, which restlessness, that type of stuff can also interfere with eating to some degree as well. So if you have a person who their eating pattern has changed and they're not eating well, and especially if they just started on a new medication or have had an increased dose of a medication, make sure you look at medications as a potential cause and discuss it with your pharmacist, your nurse, your physician to see if that might be part of the problem.